Hello, NLA membership. My name is Joseph Sassine, and I'm current president of the National Lipid Association for the 2020-2021 year. Representing the National Lipid Association as president in 2020-2021, I consider a great honor. I've always had a special part in my heart for the National Lipid Association because of their commitment to diversity and inclusion. And also, I'm very proud that we now have equality. So I take this responsibility seriously, and I'm very grateful for this opportunity. During my presidency, I do have 4 goals for the organization that do tie into the core values of the NLA and also the associated goals of the National Lipid Association. For those of you who may actually not remember the mission of the NLA, it is to enhance the practice of lipid management in clinical medicine. And there's 6 corollary or related, goals that tie into that mission. One is to have a multidisciplinary approach. Another is professionalism, public service, continuous growth and development, business ethics, and also cooperation. With those in mind, I think it's appropriate to have 4 goals that I would like to accomplish during my presidency. And these all tie into the spirit of the National Lipid Association, being multidisciplinary, having that public service role, and so on and so forth. So the first is to really focus it on improving the tear sheets and infographics that we have available. As clinicians that focus in on lipid management, we need the best available trustworthy tools, which are called out in our guidelines to help guide our patients for appropriate use. So that is one of the missions that I have, is to improve those tear sheets. Not saying that they're inaccurate, but I think fully deploying them for the power that they have, I think is important for us to focus in on and maybe actually make them a little bit more patient-friendly using infographics. The second goal I have is to promote the power that we have with interprofessional teams in lipid management. Other organizations have recognized the value of a team-based approach for cardiovascular risk reduction, in particular for reducing cardiovascular burden by managing things like hypertension, diabetes, but most importantly, lipid management too. So we need to actually go on record and embrace that and promote the value of it as it's incorporated in our national guidelines. The third is to really look at a gap in perhaps consensus opinion. We all deal with patients that have cardiovascular risk, but primary prevention patients who are older is a focus that I would like to engage with. I think expert opinion in this area on interpreting the best available evidence for this population of primary prevention older patients is an excellent role for the National Lipid Association. And it's one that I think that I would like to see us accomplish and fill that care gap. The last is to fully realize and embrace our core value of diversity, inclusion, and equality, which was eloquently stated in our statement that was released in June of 2020 during the first week, which really goes on record for our commitment to both in diversity and inclusion, which has been a long-lasting goal and core value of the National Lipid Association, but also to include equality, which is very important during this time. Thank you for your attention.